I think one of the things that I've been like noodling about is as some of these companies that I've admired have grown from like itty bitty startups to now huge companies like Maven is one of them. And then Tia, they're just huge names now in telehealth and digital health experience, especially in women's health. And I'm like, would I leave my consulting to work for one of those someday? But I don't know. I don't know where it'll take me because right now the thing I love about the consulting is the flexibility. Like, I love to travel. One of my goals is to like take my kids to as many countries as I can before they go to college. And working for yourself, you can plan out the time to be able to do that. So next couple of years, I'll probably keep doing this, but who knows? Who knows
Mhm.
about that? I mean, clearly looking back, I could have never predicted any of the things that I ended up doing. So who's to say?
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 80. Hi everyone, Omari Richards here. Thank you all so much for joining me once again for another great episode. Before anything, be sure to follow me on Instagram at the PH Millennial. Be sure to subscribe, to leave a review, to leave a like, to share with a friend. Greatly, greatly appreciate it and helps get the show out to more people. Helps the show a lot. So be sure to do all those things to support the podcast. And if you'd like to support, you can go to thephmillennial.com / support or buymeacoffee.com / and support there. But I really enjoyed this episode. Been trying to connect with this person for a while. Glad that we got to finally sit down and chat and get to share her story about public health tech, how she got involved, how she built up that tech experience. Because I think a lot of people probably have these questions about a lot of the tech side of things that we just don't know about in public health. So I think she is a light in this field. So be sure to follow her on Instagram and tune into the story. Great story. But I'm going to stop talking. I hope you enjoyed the episode. Today, we have a public health and tech professional who loves working with female founders, particularly in the consumer healthcare space. She got a Bachelors of Arts in History and Spanish at the University of Mary Washington, then got a Master of Public Health at the University of North Carolina at Chapel Hill. She currently is the CEO and digital health consultant at her business, Made Health LLC. Check her out on Instagram at Made Health. We have Katie Donohue McMillan, MPH. Welcome to the show.
Thanks, Amari. Glad to be here.
I'm glad to have you. I'm glad to have you. I know that we connected. Well, we connected on Instagram, and then we connected through Onboard Health as well, and that's been awesome to see you there as well.
Yeah, we're just virtual friends.
Yeah, so soon to connect in person for sure. Yeah. So how are you doing, and how you been coping during these times?
Oh gosh, it's crazy. I started my business like March 1st, 2020, and that was when it was still like, oh, there's some random COVID cases happening in the Pacific Northwest, but that probably won't affect all of us. And then 3 weeks later, we were pulling my daughter out of preschool. And so it ended up being like a blessing in disguise, I think, that I made the decision to have my own company because it offered me a lot more flexibility. Because I ended up having 2 kids out of childcare for a year. So it was wild. But, I got to spend more time with them in a way that I probably wouldn't have otherwise. And, I just do all the things that, try to keep me sane. So get out and get some sunshine. That's one of the nice things about being in North Carolina is like a lot of sunny days, get some exercise, read a good book, and figure out how to separate like work time and family time the best that I can.
Okay. Well,
But
sorry. What was that?
I said, how about you?
I've been doing well as of late. Did not start a business on March 1st, right before the pandemic, which I can't even imagine like all of those feelings and things that must have went on with that, and then like taking your children out of school and just not the unknown of the pandemic in the beginning and what it would be and how long it would last and everything that has come out of it. But for myself, I am doing well for the most part. I cannot complain. My job is going well. Probably this podcast platform is going well. Get to talk to amazing people like you. So I am happy about that.
And at least now, like, we can somewhat move safer through society with like vaccines. And in North Carolina, at least near me, like, people are really good about wearing masks. And, you know, I'm not eating indoors at restaurants yet, but it feels okay to be able to grab a coffee with a friend and sit outside and chat for a little bit. And so those things have made everything a lot easier, I think, than this time last year.
Yeah, absolutely, absolutely. And it's slowly becoming more endemic than pandemic, but slowly, keywords. Everyone still get vaccinated, wear your mask, take proper precautions to protect yourself and your loved ones. Thank you. Yeah. So how do you identify, and tell us a little bit about your personal background?
What do you want to know? I mean, I can give you like my whole career story.
I want to know more personal than career, because we're going to go into career. So like the way where you're from. Yeah.
I was actually born in Germany. My dad was in the military and was stationed over there. And so I lived there for a year before I came to the United States. I think I got my passport when I was like 3 days old. And my parents just took me around in a backpack basically around Europe for the first year of my life. And then moved back to the US. I lived in Maryland, Massachusetts, another part of Maryland, Kansas, Alabama, Virginia, and now North Carolina. So I am a wandering spirit, I think, because of that. And then, yeah, because when I was in college, I was like, I definitely want to study abroad. So I went to Spain for a year, or I went to Spain for a semester, finished college, moved back to Spain for another year, which my parents were like, what are you doing? Get a real job. And I was like, no, you made me this way. Like, literally had me in another country. And so, yeah, I love traveling. That's like one of my favorite things. Big reader. I like historical fiction. And I have 2 kids. One just turned 2 over the weekend. And I have a 4.5-year-old with my husband. We live outside of Raleigh in North Carolina. Yeah, like to cook a lot. It's one of my big things. And yeah, just basic stuff.
Okay. Well, thank you for sharing that. Firstly, I want to ask, how do you think like living in all those places has impacted your view of work, of life, of public health, and etc.?
I think it's like a great exercise in empathy because, you know, I've lived in the Northeast and I've lived in the Deep South and I've lived in the Midwest and I've lived in metropolitan areas and like more rural areas. And because of that, I think, you know, in public health, you have to go outside of your own experience a lot and just empathize with other people or hear about things from their point of view. And I think, you know, it's nice to be able to connect with people in a lot of different places or to like put my own self aside to listen to other stories because that's like kind of how I always grew up, like meeting new people all the time. And so I think that also made me a bit extroverted. And because you know, every 2 or 3 years, I was the new kid at school. And so I had to make a whole new friend group all over again and get to know my teachers. And so because of that, like I'm not afraid to talk to people now that I'm an adult, which is good. And yeah, definitely give me a lot of wanderlust. That's been the other hard thing about the pandemic is like before we got on recording mode, we were talking about traveling and I've pretty much only been places within like a 3 or 4 hour drive since the pandemic started. And I used to love to go abroad at least once a year. So to some country I hadn't been to before. But yeah, I think it's made me like always want to see how other people live, always want to like understand how the rest of the world works. And then also just be open and listen to other people, and try to, I think as well, like extend kindness to each other. It's always, having been the new kid a lot, like whenever I see a new person in a room or at a job or something, I try to be really welcoming to them because I know that can be difficult for people.
Absolutely. I love that a lot. Thank you for that answer. I definitely resonate with a lot of the things that you are saying there. And I feel like when you are able, I didn't move as many times as you did when growing up, but I moved a couple of times, and I feel like and I've traveled quite a few places as well. And I feel like just realizing how big the world is, but yet how small it is, and that people are people, but people have different cultures, and really understanding and getting to learn and love that for what it is a huge skill set in itself, and it's like a huge experience and knowledge. And I think it's been hugely beneficial in my life and in my career as well. So yeah, I just love when people talk about that, because I think that in itself is like an education. So I appreciate you sharing.
It's like a core element of my like parenting philosophy for my kids as well, because we live in like a suburban town in mid-Atlantic state, and I'm like, I don't want my kids to think that this is the way that everybody lives in the world, and I want them to just constantly be exposed to like other ways that people live, but also know like you can find common ground with people like anywhere that you are. And that's, I think, also part of the joy of traveling too, is like those surprising friendships that you make with people.
Absolutely, absolutely. I love that. And I hope that you're able to get out and travel internationally to somewhere that you would love to sometime soon. And on that note, what is your favorite place that you have traveled to?
Ooh,
You can drop a couple if it's too hard to name one.
well, it might be Peru.
Okay.
For my 30th birthday, we hiked the Inca Trail to Machu Picchu, and it was me and my husband, and we brought both of our families, so our parents and our siblings, and did a couple days in Cusco, which is awesome. So you mentioned like I was a Spanish major, so anywhere that I can go and like flex my Spanish is really fun. And it was the most like physically challenging thing that I've ever done, but it was also amazing to be like, I'm in the middle of the jungle, like walking through these ancient ruins, and I really loved it. I think it's a trip of a lifetime that like if you can do it, you should do it.
Awesome, awesome. Well, I hope to get to do that sometime soon as well. I haven't been to Peru as yet. And before we talk a little bit more about your bachelor's in Spanish, what does
Mm-hmm.
public health mean to you?
Ooh, good question. Yeah, I think public health is like the baseline of health for society. And then like tacked on top of that is like responsive care through the medical system. But, it's things like vaccines and like fluoride in the water and community planning and making sure that people have healthy food to eat. And I think like it's built up in a lot of different ways. Like some of that is done through government agencies, and some of it's done through nonprofits, and some of it's done through businesses and city planning. But I love like how interdisciplinary of a field it is, and that you can always be learning and like connecting with other people that do something different. And it's public health is all of those pieces working together to make sure that we have, as humanity, like basic needs taken care of, and hopefully on a trajectory for healthier and happier lives.
Yeah, yeah, and I like that. That's a cool answer. So I appreciate that. So going on to your public health story now, after we chatted a little bit about your life there, you got your Bachelors of Arts in History and Spanish at the University of Mary Washington. So what was the thought process for you going into this?
So I always liked history. That was like one of my favorite classes when I was in high school. And then, from the subject matter piece, like I always thought it's fascinating to understand what happened in the past. And then I always preferred to write instead of take a test. And so most of the history classes, it was like you turn in papers instead of exams. So I felt like I had more control over my grades that way. um, but yeah, I really love the critical thinking element to it. And then looking back now, I've realized that pretty much every paper I had to write, I looked at different issues from like a socioeconomic and political standpoint. And all of those things like contribute to how you consider different public health problems as well. So was a surprising connection that I made like a long time after the fact. But yeah, I just found it really interesting. And I can tell you, there was one class that was kind of like my jumping off point into getting into the world of public health, which was a history of Latin America course. And you had to find an issue in current events that had its roots in historical issues within a country. And so at the time in the newspaper, there was things going on about women's reproductive rights in Nicaragua. And in my research, I found that like whether or not women could access birth control or have an abortion, or those are kind of like the main pillars, I guess, like really depended upon like who was in power in the country, and then how deep in the pockets of like the Catholic Church they were in, which was, I grew up Catholic, and so that was like wildly disturbing to me to find out. But it was my first time kind of going into that foray of like, well, what is it? What is this? And then like talking with my professor out of class, and she's like, oh, well, it's kind of, these are like kind of like public health issues. And I was like, what is public health? Like I hadn't even heard about it before. But I was like, but I find this really fascinating and interesting. So that was kind of my first entree into it. But yeah, so I loved history. I loved all my classes, loved writing, good skills that I've taken forward. And then I did Spanish because I knew I wanted to study abroad. I knew I wanted to go somewhere that didn't speak English because like I had to pick something that was more challenging for myself. And I had taken a couple of years of Spanish in high school. And so I was like, well, I guess I'll go somewhere to speak Spanish. And then in a semester, I could get almost half the credits that I would need for the major. So I was like, well, I guess, every other semester I'm here, I can take like 1 or 2 classes and, basically get a double major. And so I just decided to do that. And that has served me well too. Like in public health, it's good to have a second language, I think, too.
Absolutely. That sounds like a solid game plan that you went into school with, especially with like using Spanish to go study abroad. I like that thought process a lot. And then to that, you said when you went to study abroad, is this the same English language and culture assistant position that you had?
No,
Or,
that was what I did after college.
okay.
So
Okay, okay. Before we talk about that, tell me about this study abroad experience and how was that for you?
So if anyone else is listening or considering a study abroad program, like there's various ways that they're set up. Sometimes you live in a dorm, sometimes you live in an apartment, sometimes you live with a host family. I really wanted a program that had a host family so that I was more immersed in the culture and that I wouldn't be able to just like leave school and speak English all the time. Like I'd be more forced to work with the language. And so I was in Valencia, Spain, which is like on the Mediterranean coast. And the program was through the University of Virginia. I'm not sure if they still do it now, but I had a host family. Well, I ended up having a host mother. I called her like my fairy godmother. She was in her late 70s, I think. She had lived through like the Franco dictatorship era, had so many great stories, but like she spoke no English at all. So I remember we got picked up like 24 hours of traveling, and she picks me up and she just starts like talking to me in Spanish, and I'm like a deer in headlights thinking I'm prepared for that after taking a couple years in college and in high school. And it, I think, took me probably like 3 or 4 weeks before I started to feel conversational. But I remember the first time like I could crack a joke with her when we were having dinner. I was like, yes, like I am starting to get this a little bit. And so yeah, I got to travel a lot throughout Europe as well while I was there. But I think one of the things I really took away from it is also that feeling of like being an outsider and being almost an immigrant. And so like I just thought like it's Europe, like I'll blend in. And everyone knew I was an American. I guess it's just like my face looks very American, and I would be stumbling over things, or like I'd have to go to the post office and figure out how to ask for stamps to mail postcards home and stuff, and have to be like speaking in my head on the way there, like, how do I say this? What do I ask for? How do I do like the kind of conversational greeting stuff? And then be like sweating while I'm there, get my stamps and get out. And I'd be really proud of myself. And so I think like that was extremely humbling experience too. And, but I'm so glad that I did it. And it was really, I think, one of the most like impactful things that I've done in my life.
That's a great experience. And I like that you highlight also that there are different types of study abroad programs, and you opted for the one that was the most immersive, that kind of forced you to get out of your English bubble and really push to understand the language and the culture and actually how it's spoken, as opposed to like having a bunch of other students that you're going back and speaking English to and just like enjoying all those other aspects of a potential study abroad. But I'm glad that you're able to experience that. That is really awesome.
There's definitely still some fun. I mean, Spain is known for their nightlife, and I will let you know that it is a blast if you ever want to go. But lots of cool cultural stuff there too. I mean, I loved like Spain's very interesting because there's the European element of it, the North African element of it. They've, and then North Africa kind of pulled in from the Middle East. So the architecture is fascinating. It's called like Made architecture, and it's just super unique. And I love that too. Great UNESCO World Heritage sites around. If you're a history nerd, highly recommend it.
Okay. Well, yeah, take that recommendation, everyone. And then, so you graduated from your bachelor's program, and you said you moved back to Spain. Well, when did you study abroad in Spain in your undergrad career?
It was the spring semester of my junior year.
Okay. And then you come back, and then you decide to get a job abroad in Spain at as an English language and culture assistant at IES Alto Conquero, at the government of Spain. So how do you go looking for a job like this, first of all?
I actually thought I was going to go to law school. And I interned. That was another reason why I did a history major, was because like when I talked to the pre-law advisors, they were like, yeah, like political science, history, English are kind of like the top majors. And so that's what I thought I was going to do. And then I interned, I think the first semester of my senior year at a law firm. And I was like, I hate this. I am not doing this. So I always encourage people to do internships because it's like such a great way to get in and get out and decide if you like something. And if you don't like it, like it's just as good of an experience than if you do like it, because it points you in another direction before you get a job or you've signed a contract somewhere to be there for a while. So so then I started thinking, okay, well, like now what am I going to do? And despite doing my Spanish major and my semester abroad, I felt like my language skills were still not where I wanted them to be. I wanted to be like totally fluent. And so the Spanish department sent out an email about this program that was between like the Spanish embassy and the American embassy, where they brought in native English speakers to come and teach at public schools there. And so you worked like hand in hand with Spanish teachers and taught various curriculum. And so I thought, well, that sounds interesting and I'd like to go back. So I might as well apply. And I think I found out maybe a week before graduation. So I was like, got something to do with my life. But I ended up at like a secondary school. So it was a middle school and high school combined together in southern Spain, outside of Sevilla, about an hour outside of Sevilla. So in a smaller town. And I taught English. So some classes were just like straight English, but then I also taught math, social studies, and PE, which I hated PE growing up. It was like, this is payback from the universe. But like I had to speak to the kids in both like English and Spanish in those classes. So I did that for a year. And it was awesome.
Yeah, that's fascinating. That isn't something that a lot of people would jump at. And like kudos for you for taking on that opportunity and being like, I'm not where I want to be in my Spanish, and I'm gonna actually seek out this opportunity that's gonna help me to become as proficient as I can right now. And I guess no better time to do it than than right before graduation, right? Like getting that like acceptance and then knowing that you have a job for a year. So that's awesome.
Yeah, it gave
And
me something to do. And my parents, I looked at other programs as well. Like I applied to a program in Chile and some things in Central America. And my parents said, as long as you get a job that pays you and that you get health insurance, we'll back you. And so this program came through, and like you had a monthly stipend. So you knew you were going to get paid every month, and you got your health insurance. And so I was like, check, check, I'm going. And it was hardly any money. I have to say, it was, I think, like 600 euros a month, and which was maybe like $850 a month. And I got paid in cash, which is so crazy. Like I would go to the principal's office and he'd lay bills out on the desk. And it was funny because it was like 600 and something and change. And he'd be like counting out pennies. I'm like, what? And then I'd be walking home from the school with like my entire month's paycheck in my pocket, being like, oh, I hope nothing happens like on the way home. But
Interesting.
yeah, it was a good like experience in like living on very little. And I'd get home and I'd like be like, all right, here's my rent, and like this is what I think I need for groceries, and this is what I need for like utilities, and then transportation, and then whatever was left was what I could travel on. And so just be traveling on the cheap, staying at hostels, etc. But hey, when you're 22, like you can do a lot.
Yeah, and that's one thing I love about Europe. It's like easily accessible to get to places, and it doesn't cost a lot. Like once you get there, it's pretty easy to travel around Europe and stay in different places. And beer is also very cheap if you like beer for the most part. So
Even cheaper than water in some places. So
yeah, yeah. Okay, so you come back to the US, and then did you get this job? I guess did you apply for the so you came back to the US. Your job was a travel and logistics coordinator at the University Research Company LLC Center for Human Services. Did you get this job when you were abroad, or did you come back and get this job? What did that process look like?
So while I was in Spain, I started to apply for jobs back in the US, and I didn't know exactly what I wanted to do, but I knew that I wanted to do something in like the world of social good. And so I applied to some like educational NGOs, some healthcare, like public health organizations, global like study abroad organizations, since I really enjoyed my experience, like women in political, like putting women in political position type of organizations. I'm from like, I went to high school in the DC area, so I was mostly looking at stuff around that area. And so I was kind of like casting a very wide net. And what's crazy is I applied for this job and I just thought like, well, I've been traveling, so this seems like I should be able to do this job, which was essentially booking like plane tickets and hotels and getting visas for people at this like big global public health nonprofit. And I put the application in, and then a week later I followed up via email. And I always tell people like, follow up via email if you have a online application, because like it doesn't necessarily always go in. And because I was applying from another country, like it hit a firewall. And so the woman was like, the HR lady said, thank you so much for applying and and following up, because I didn't see your application otherwise, and like we'd love to have you for an interview. And so I was like, well, I'm actually moving home from Spain next week. Like, do you think I can come in? And so I got home, I had like a phone interview, and then I came in person and had an interview with who ended up being my boss. And then I got offered my first real big girl job shortly after that.
Okay, that's awesome. And then, so was it difficult for you to do this job? Like, what was there a lot of tasks? You said it was a lot of like logistics and visas and other things like that.
Yeah, it was, I learned quickly that it was not what I wanted to do for the long term,
Mhm.
but I really liked the mission, and it was my first time. So they are a big global health NGO, um, multi hundreds of millions of dollars in contracts annually, work in all types of countries around the world. Most of their focus is on like using quality improvement methods, and they did like non-communicable diseases work, maternal and child health, fertility, HIV/AIDS, malaria, and other infectious disease work were like kind of the primary uh, like silos, I guess, that they worked in.
Mhm.
And I just decided that I wanted to move more into the public health side of things. And I just immersed myself as much as possible. It was crazy because like I'd be put in a cab and they'd be like, oh, can you go to the Afghan embassy and get this person a visa? And I'd be like, sure. And you'd show up and there'd be, like armored guards outside and me dropping paperwork off and hopping back in a cab and just flitting all over the city to get stuff done for people. Because oftentimes it'd be like, okay, they need to be in another country like next week. So we have to push all this stuff through. Um, so yeah, I realized I liked booking my own travel. I didn't want to be a travel agent with my life, but I was interested in what they were doing. And so I just started, like, anytime there was a lunch and learn or a brown bag session, I would go to it. Anytime somebody asked if people could help out with their projects, like there'd be a paper that they had to submit a report to USAID or the Gates Foundation and be like, oh, can somebody edit this? Like I would just volunteer to do anything that I could to get more exposed to the actual work. And so eventually, I think I was in that job for about a year and a half. And then I applied for a project coordinator position, which was more on like the real like running of the project side of things on the global health side, and ended up in the maternal and child health group, which really changed the trajectory of my life, I would say.
Yeah, well, I'm glad to hear that, and I would love to hear how so did it change the trajectory of your life?
So I think I was there for about 2.5 years when I started realizing, like, in the world of global health, and I'm not talking down to you. I'm explaining this in like layman's terms because I'm not sure like where people are coming in when they're listening to this podcast. But basically, like in the world of global health, there are sort of tiers where people can work. And if you have a college degree, you get to do this. And then if you have a master's degree, you get to do this. And if you have a PhD or an MD, like you get to do this. And so I realized that I would continue to probably be in like an administrative type role where I was, booking calls for like the art director and the country directors, or like reviewing reports and doing financial planning, which were all like really good skills, but it was a little bit away from like the meat of the public health work. And I realized I needed to get a master's degree in order to be invited more into those types of conversations of thinking about actual interventions and program planning and stuff. And so that's when I started talking to people about going into an MPH program. And there was a few like recent grads that had done MPHs that worked there. So they were great people to pick their brains about like, where did you go? What did you like? What program did you do within your like university that you went to? And so doing that like maternal and child health work informed my decision of like where I ended up going, which was at UNC Chapel Hill, and then to be in the Department of Maternal and Child Health. But I applied to, I think, like 8 different programs. So
Okay. Well, before I miss this, I want to highlight that you said that you got your foot in the door as like a logistics person doing a lot of the things for this cool public health organization, and then at any moment in time, you took it upon yourself to say, "How can I help? Oh, yes, I can help with that. Let me do this," and continue to build your skill sets, build your knowledge, as well as just show that you have a willingness to learn, which helped you get into this other position as a project coordinator, which had more meaty, less administrative type of work. But then you also learned that in the global health structure, there is like a hierarchy of getting to different roles. And I do think that that is what a lot of people who have worked in global health who have come on my podcast have said. And yeah, I agree with that. Like even looking at me, if I want to go to Trinidad to work in public health in a health related field, they're not really going to look at me unless I have like a PhD or unless I'm like doing something like really, really awesome. So it is very interesting that there are these kind of hierarchies and like a status quo in a lot of these organization, well, I don't know, society, however you want to call it.
Yeah, totally.
Yeah. So you get your master of public health, or you apply and you get into your master of public health at the University of North Carolina at Chapel Hill. During this time, were you still working as a project coordinator for global initiatives?
When I was applying, yeah, I was taking GRE prep classes at night. So I would like get on the metro after work, go to GRE prep class for a couple hours. And I think it was probably 2 or 3 months that I was doing that. And then I'd be also on the train in the morning, like going through my flashcards and doing my workbooks so that I could take the test and get in. And I think that more and more programs are like getting rid of that requirement, which I think is awesome, because it's like, why do I have to take high school math? Like, resurface this in order to take these exams. And one of the things I really liked about UNC, at least my department, was that they did interviews in person. And I felt like I could, communicate myself pretty well on paper, but I was like, if I can get an interview, I can sell it. So I was really happy about that. But yeah, that's how I think I applied. I applied there, Tufts, Tulane, Harvard, Boston University, Michigan, maybe GW. I don't know. I basically looked at like the top 10 programs and was like, I'm just gonna apply to all of these.
Fair enough. Okay. I definitely think that UNC is a great school, and that's awesome that you also like the department. And like to your point, you knew that your strength was being there in person and getting that interview, and you chose a program that had that kind of interview style for you to get in, which played in your favor as well. So during your time in UNC Chapel Hill, not G, sorry, you were a summer fellow at KUSA, and I think you were in Malawi, or you worked for an organization in Malawi. Tell me about that.
Yeah, I was in Malawi for the summer, in Southern Africa, and I got connected there through our department chair. He knew some people there, and because the organization I had worked with before kind of focused on quality improvement, they were trying to implement some quality improvement methodologies into how their programs were being run with CARE. So CARE is like a big NGO, and they have offices all over the world. And so it just ended up like there was a project happening there, and they said, do you want to go to Malawi for the summer? And I was like, yes. I have seen global health from the US desk side of things. And while I was in my job, I did get to go to Uganda for a couple of weeks, which was like my one cool travel thing that I got to do while I was itty bitty public health professional. But I was like, yeah, like immersive experience, I'm all in. And so I ended up being there, I think, for 8 or 10 weeks. It was most of the summer break. And that was another reason why I chose UNC. Some public health programs are a 1-year program and some of them are a 2-year program. And I really wanted the opportunity to do an internship during the summer again. And so that's why I also opted for a 2-year program. I think it's another important consideration for people when they're looking at what type of program they want to go to. Some people are just like, I want to get in and get out and get my degree. And like, I totally get that. But I wanted to have like the all-in experience. I went full-time and I wanted to do the internship. So so I was mostly in Lilongwe, which is the capital there. But then I also went out to some of their community hospital sites as well, and like did some review of how they were doing data collection within their hospitals, and thinking about how they can implement some better systems and looking at areas where things were not like improving as fast as they wanted them to, and did a few teachings with like some of the community health workers there.
Okay, that was an awesome experience. I could only imagine. I would have definitely said yes. Let me do that as well, and that's cool that you were able to do that. And then also during your time at UNC Chapel Hill, you were a graduate research assistant at the Gilling School of Public Health. So, what type of work did you do there?
So with that, I kind of rolled that also into my master's paper. So that was one of the requirements, was to do a master's thesis. And I ended up getting connected with an OBGYN professor who was also interested in global public health, had done some work abroad, but he wanted to look at the use of QI, quality improvement, in perinatal health initiatives around the world. And so the first half of that was a systematic review of like, where has this been done? How has it been done? And has it gone well? And then the second half of it was helping them to write a grant to get funding to do a project with an NGO that they were partnering with between UNC and then this local NGO to do some perinatal QI initiatives. So I ended up getting myself like 2 master's projects instead of 1. But yeah, it did pay me at least a little bit of money, which when you're a grad student, like anything is welcome, I think. And yeah, just a little bit more like hands-on work to be able to do other than just my coursework.
Okay. Well, thank you for sharing that. Did you have any other takeaways from your MPH time that you wanted to share with us?
I think like there's so many ways that you can shape your MPH. It's such a flexible degree, which I think is awesome. And I really liked that you could do a good amount of electives, and there would sometimes be like a 1 credit course, or it would be mostly, like once a week for an evening, you go to a lecture and you just write 1 paper at the end of the semester, but it'd be a good way to get exposed to something that you may not take otherwise. And really good experience with learning how to work with groups of people. I felt like there was tons of group work in my MPH program, and at times you hate it, but that's how the world works. Like you have to collaborate with people and figure out how to do it. And then I also just looked for other opportunities. So I ended up being involved with our student government as well, and did some fundraising efforts for the school. We did a weekly lunch. So they had this thing called Hunger Lunch, where you would pay $3 and you would get rice and beans and cornbread, which was like basically supposed to show what most people ate like around the world for lunch. And the food was prepared by an organization called TROSA that helps people like recover from substance abuse. And then the money that came back from it like went back into the organization. So it was like another cool way to be working like in a public healthy type thing where you're, supporting a good group and then helping bring back money into it. And then also like bringing awareness through the student population as well. And like with my student government stuff, I ended up also getting to shape some of the curriculum at the school. I was in a meeting with the dean, and this was it's like that Latin American class that I took in undergrad really changed things for me. And then in my MPH, I took a public health entrepreneurship class. And I think that really like changed things for me as well. And I had always thought I was going to go into like reproductive health, like the next step on the rung, basically, in global public health was my plan when I went into my MPH. And by the time I graduated, it like totally changed. And so, yeah, I had heard that there was going to be this public health entrepreneurship class when I was looking at courses, and I emailed the professor to ask for the syllabus. And she was like, "Oh, I'm not teaching that this semester." And I was like, "Oh, well, I'm going to be graduating, I'm not going to get to take it again." But I had just heard the dean speak and say that she heard that students were getting more interested in entrepreneurship and this crossover between like business and social responsibility. And it was something that the school was going to be looking to get more involved in. And then after I heard about that from the professor, I emailed the dean and was like, "Well, if you want to put your money where your mouth is, can you this professor told me the only reason she can't teach this class is because she needs a little bit of funds to pay for a research assistant or a TA for it. Like, are you interested in doing that? And then the professor emailed me back like a month later and said, so when do you want to have the class? The dean gave her the funds for it. So I think that's another thing, like as a student, your school wants you to be happy and they want you to like flourish as well. And so just also ask for anything that you think you need. Like we also decided to host a big fundraising gala that they had never done before. We're like, okay, we're gonna do this big event and we're gonna raise money for a local nonprofit that did global health work. And we had students vote on like who the organization would be. We had people nominate different groups. The whole student body voted for it. We ended up having like a nice event. We had a DJ and a dance party, and it was great. And faculty and students were all there, and you know, it was fun, and it was a great way to like flex some leadership skills and raise money for a good cause.
So needless to say, you were very busy during your MPH program.
I was very busy. I also met my husband during my MPH, so
Okay.
yeah.
Was he getting his MPH as well?
So he was doing a dual MD MPH. Okay. And so with that program at UNC, it was, you did a 1-year MPH between your 3rd and 4th year of medical school. And we met in Spanish for healthcare professionals, which was maybe another class that changed the trajectory of my life.
Absolutely did as well. That's awesome. And that's cool to hear you say that you wanted this class and you literally went out to the dean and got the class back in, like reinstalled. And I think public health entrepreneurship is something that a lot of people are interested in, and kudos to UNC for having that type of course, because I don't think a lot of schools have that type of course or even give people a lot of that skill set or that knowledge that they need to be successful in that. And I'm guessing that ties more into like your business now and all the things that you do that we're going to dig into a little bit later on. So you graduated from your MPH program and then you got a job, I'm guessing this is after, as a public relations and partnerships coordinator at the Water Institute at UNC Chapel Hill. So how do you come across this and then what do you do in it?
So I think I was really interested in, after taking that course, like the idea of corporate social responsibility, and that more and more companies wanted to invest their money not just back into the business, but also into causes. And that is also a big driver, I think, for consumer loyalty as well. As like, we don't want just the products to be good, we want the businesses to be good as well. And so I connected with a woman who worked at the school, and her job was basically to be a fundraiser. And then some people at UNC were also advisors to companies, where if they were saying like, we want to invest in maternal and child health somewhere, like, how should we do it? Which organization should we partner with? That kind of stuff. And then so in this case, there was a group called the Water Institute, and their thing was all around like wash stuff, like water, sanitation, and hygiene. And this woman that I had just kind of become friends with when I was a student, she was on the verge of retiring, and said like, hey, if you want to get into this world, I can connect you with this group. And they do a lot of like public university partnerships, and check it out. So I did that for a couple months, probably like 6 months, I guess. It was definitely not meant to be a long-term thing. They were trying to raise money for a big annual conference that they do, which is like one of their cornerstone projects. And so I was driving out to meet with people to see if they would donate to the conference, and then also connecting with speakers and doing some organization stuff. But it was like hourly wage, just it was kind of like a stopgap gig, I guess, while I was looking for other things. But one of the classes, when I took that public health entrepreneurship class, I met the CEO of a local software development company, and that's what I eventually ended up working for after that.
Okay. Well, Yeah, tell me how you made that connection, and did that connection that you made earlier on with the CEO of Smashing Boxes, where you were the client engagement specialist, did that connection help you out in getting the job, or how did that work out for you?
So when I was in Malawi, I realized even in the most remote places, and Malawi it used to be the poorest country in Africa. So I was in some pretty remote places, but I found that wherever you were, you could always find Coca-Cola and you could find talk time. So like all the cell phones there were pay as you go. And I was like, wow, from a distribution standpoint, like that's fantastic. And there's actually some organizations out there that like pack medical supplies within Coca-Cola boxes in order to distribute them to more remote places because they have one of the best distribution networks in the world. But then I also was like, man, people are on their phones like everywhere. And this is such, I mean, and this was 10 years ago. So it was not so obvious that technology was going to take off in the way that it has, at least as far as like smartphones go. And so, because when I graduated college was 2007, that was the year that the iPhone came out. And then a couple of years after that was when I was in grad school. And so being in more of the remote corners of the world, we were seeing, okay, well, in less than 5 years, like everyone has access to this, which is crazy. And I just thought it was such an opportunity for public health as far as like education and appointment reminders and being able to submit like community health records. Like some community health providers had miniature EHRs like on tablets and stuff. And I just thought it was so cool. And so when I took the class, this guy came in. He was the CEO of a software development company. I looked at their website. They had done 2 or 3 projects in the global health space. One was like a malaria website, and I forget what the other one was, but I was like, interesting. Maybe I could be useful. And so I just contacted him and we had coffee and met on and off over the next couple months. And he was like, I like you. I don't know what to do with you because like we're a bunch of bros in sweatpants in a basement, like coding websites for people. But maybe I could find something for you to do. And then after a while, he reached out and said, I really want to build up like our area of healthcare expertise. And one of the things that I found is it's hard to communicate across the aisle. Like we have people that are really techie, and then we have people come in and you would say like they're really healthy. And the two people had a really hard time coming to agreement of like what a project would look like and what it would take to do something and how long it would take and like how expensive it would be. And the health people would have to provide content, but they didn't know how to communicate what they wanted on a website. And so he's like, I just think it would be useful to have somebody that can translate across the aisle. And so that was what that first job ended up being like, was almost in like a business development capacity. So I would go and, meet with people that were like, well, a lot of global health NGOs are in the area. So that was like a comfortable space for me. Like FHI 360 is around us, RTI, PATH has an office here, a few others. And then like UNC and Duke have their own global health stuff as well. So that was some of the first forays, was reaching out to those people that I knew. And they were like, yeah, we do want to do something in like the health space. Can we talk to you about our ideas? And then bring projects in that way. And then I ended up being dissatisfied with having to hand over my little baby projects to the project teams, and then ended up like becoming more into this, what eventually was a product director role, digital health strategist / product director. So I would help bring projects in, and then once they came in, I would work directly with like our design and development teams to make sure that whatever the people on the healthcare side of things, like whatever their big ideas were, that we were creating real life things for them.
Okay, thank you for sharing that. First question I have there is, you're saying that you're like the connector between the tech and the health side.
Mhm.
How did you gain that tech skill set or that experience on that side? Because I don't think we touched on anything besides maybe your public health entrepreneurship class, which I'm guessing isn't really tech. So let me hear about that.
Yeah, that was kind of like the deal with the devil was like, you come in and bring your like network and your knowledge of public health, and I will teach you everything that I know about like software development, and I'll let you like directly work with our teams and sit in on those types of meetings where they're like thinking about what the solution should look like. And I basically had an on the job training in tech stacks and UX, and you know, some of the stuff that I loved the most was just we'd had all these whiteboards like around the office, like traditional tech office type things, and just saying, okay, like they want it to do this, 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 and this, and I think maybe it should look like this. And I realized I had just a very intuitive sense of how to communicate needs and problems into technology solutions. So I would just come to them and say, like, I think it needs to look like this. And I'd just be drawing like little squares and this should connect to this and tap, 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 tap. And then the developers would be like, okay, they go back to their desk and say, I think it'll take like this much time. See if they'll buy it and they'll do the project. And so yeah, it was really just on the job training, I would say.
Okay. Well, thank you. That and that makes a lot of sense because I think that's the other thing that kind of like amazes me about your story is like a lot of people in public health aren't really in tech. So you getting involved and getting that skill set and I guess wanting to learn and reaching out to the CEO and all of that is all awesome. And I'm very excited to it's like meet more people who are interested in this tech realm more because I think we need more public health people in tech realm and to your point more female founders as well that is awesome. So tell me how did the role change from you going from client engagement specialist to digital health strategist slash product director? Was there like a lot of learning that you had to do or what was that jump in role changes there?
Yeah, when I was at that company, which was almost about 3 years, we grew from 20 people to 85 people. So it was
Whoa.
crazy fast. And when that happens in an organization, it's like you have a new job every day almost. And so I think it started where we were bringing these new projects in and there wasn't enough project managers to take them on. And so they'd be like, well, Katie, you already know what the client wants. So maybe you can just start working with the team to get it built. And then I realized that I loved that, not just the original ideation of things, but actually seeing them come to life. And then another thing that I brought to the table that they hadn't really done before was working with the clients to think about like, okay, well, how's this actually going to succeed in the world? And a lot of development groups are just like, okay, here's the thing, like go ahead and take it out. And I wanted to talk to them about like, how are you going to let people know about this? How are they going to engage with it? How are you going to think about marketing? And, those are not like terms that you're trained in public health, like really talk about. And I always laughed, like in clinical research, it's called recruitment, but in the rest of the world, it's called marketing. I'm like, it's all about getting people to believe in what you're doing and like getting them on to engage with you. So yeah, over that course of time, like just started bringing in more and more business. And then it ended up that all the healthcare projects were about 20% of their annual revenue. And they're like, well, you know this more than anybody. And so I just started overseeing that whole portfolio and working with the dev teams and working with the clients, and also got involved in like building a mHealth like consortium in the area where we would do monthly meetups with people that were interested in digital health, and started playing some startup weekends and incubators. And I just got steeped into this whole like community and building a community around digital health.
Okay, that is fascinating, and I'm glad that you delved into this tech space, and I'm glad that you're sharing it on Instagram as well. So definitely check her out on Instagram, Well Made Health on Instagram. Um, you were a guest lecturer at Duke University. Was that while you were at Smashing Boxes?
Yeah, I started just getting involved, and I've done a few guest lectures at Duke over and at UNC. I think I did one at UNC. It was about like careers in mobile health. As students were starting to get more interested in it, they reached out to me as an alumni to see if I'd come in and talk about it and bring in some other folks. And then, yeah, at Duke, they do a master's of management in clinical informatics, and they also have like a career day. So they have people that come and talk. I've given some guest lectures at the nursing school as well. They have a master's in health informatics. So that was like digital health 101. And then after I left Smashing Boxes, I went to work at Duke. And so I would also talk about what was happening in the digital health space in the clinical world as well. So I would say like I give like 1 to 2 lectures a year at like either of those places.
Yeah.
Oh, and I also like lectured in the master. I did a 2-session design thinking and global public health lecture for a master's program there too.
Okay, that's awesome. And I know I have like another community partner that does those same types of lectures in human-centered design thinking at UNC Chapel Hill, I think it was. And I met a couple of the students that were taking that class. But anyway, that's neither here nor there. So you're saying that you moved on to an innovation portfolio manager at Duke University Health System. So how did you come across this? And I would say this is the first time in my life, like looking up your career story here, is the first time I've heard of an innovation portfolio manager type role at a university health system. So I would love to learn more about this.
Yeah. I'll say like my whole life has been being the first person in jobs. Like when I got hired as the travel coordinator, no one had ever done that before. And so I just had to figure it out and figure out what it looked like. And then when they had that program coordinator position or project coordinator position open up for maternal health, like no one had ever had that job before. So I got to figure out what that looked like. When I came into Smashing Boxes, like none of these jobs ever existed. So it's always just been like jump in, learn, figure out how you can be useful to organizations. And so again, at Duke, this is the first time anybody had ever had this job. And basically the health system. So I mentioned that I was involved in like hackathons and startup weekends and stuff. I met the director of mobile technology for Duke at the time at one of those weekends. And then, we ended up just running into each other, I felt like a few times. And he started to need a right-hand person because Duke put out a couple, I think they would usually fund like 10 projects a year that they considered to be innovative. And more of those had technology components to them. And so they were like, we just need somebody that understands like healthcare and public health and technology and that can oversee like this portfolio of projects and make sure that they all happen and that they get what they need. So that's what I was brought on to do. They asked me if I would apply and I applied and I got the job.
That's always awesome if you're in a position where they're asking you to apply for a job, and as well as you saying you made that network connection with the person that needed the right hand person, and I think we undervalue how much those network connections and following up, or as you said, like just casually meeting these people at whatever event or whatever the case might be, can play into us getting that next role that is pivotal to our career. So yeah, that's also
no, you literally never know like how it's going to turn out.
Yeah, and I guess to the point of you taking on being the first in a lot of these roles that you were talking about, what are some things that you have done or learned to really make yourself effective in that?
I think it's just like ears to the ground, talk to everybody in your organization and figure out what the needs are. And sometimes that can end up meaning that you carve yourself into another role. And so like that happened when I was at Smashing Boxes, where it's like, hey, help bring some business in, bring new projects in. And then, oh, now we have all these projects. Who's going to run them and organize them? Like, I guess that'll be you because you know about it. And you're the only person here that has like any healthcare experience. So I guess that's you. So yeah, I think, and while I was there, I just got to dabble in a lot of other things as well, like UX design and design thinking and marketing and communications work as well. And so, yeah, I think it's just always keep yourself open to opportunities and check in with whoever you're working with a lot and make sure that you're doing what they want you to do. Because I think when it's wide open, it's also easy to just start going down many, many different paths. And you have to just make sure you have a good relationship with your supervisor and say, this is like, am I doing what you want me to be doing? Because I don't want to come to the end of the year performance review time and you're like, well, you failed at this job that we had no description for.
Yeah, that's awesome. And I think it's like so important to check in with your supervisors to make sure like am I helping you? Like is everything I'm doing making your job easier? Because I think when we look at it that way and see how we can be of more help or what part of our work would help our manager do better at their work, and I think that is a great way to also view it. But yeah, shout out to you for being the first in all those roles, and that's really awesome that you were able to do all these very unique non-traditional public health type roles, which we love to hear about as well. And then to continue on that realm, after that role you were associate director of a mobile app gateway at Duke University Health System. So tell me more about that.
Yeah, so as I was in that like innovation portfolio role, people started to find out that I had used to work for a software company, and they'd be like, hey Katie, can I talk to you about my idea for an app? And I'd be like, yeah, sure, let's get a coffee and chat. And then the longer that that went on, the more I realized that there was no actual like infrastructure at the hospital system or the university side of things to support anybody interested in digital health. And I also found out that on like the vice provost for research apparently kept having people come to him and say, we want to run research studies that use apps, and we want to study obesity, or we want to study multiple sclerosis symptoms, or we want to study autism, and we want to use apps for data collection, and can you write us a check for that? And he was starting to get fed up with it. And so I ended up with a few other people at the health system and the university putting together a proposal for what ended up becoming like our mobile app gateway, which was essentially a centralized place for anybody interested in using digital health for research or clinical care. And we would support them through the process. So folks would come to us with an idea, and I would help them think like, okay, is texting the right way to do this? Is an app the right way to do this? Is a website the right way to do this? And then sometimes it'd even be like, is an analog solution the right way to do this? Just doing something on paper. And then we'd think about, okay, well, what's it going to cost? I would leverage like my connections in the tech community in the area to help them find developers to work on things, whether it was like a freelancer or a design and development agency, like a bigger group. Help them think about their IRB proposals and how they were going to protect like patient privacy and just all the things that go into like actually bringing health apps to life in the world. And that's what our group did. And I think while I was in that role, I advised on like over 200 different projects there. So it was crazy, but fun. And then we also just decided that we wanted to build up that ecosystem because more and more students and like young faculty were interested in this space. And so we would do monthly, either we would do a workshop. So like we did some user research workshops, and we did another design thinking workshop, and we did a rapid prototyping workshop. And then we would also have various guest lectures. So like one would be on like HIPAA and consumer app protections, like what do you need to know? And then one would be like FDA clearance and apps and what do you need to know? And those would just come from the FAQs that we would basically start hearing the same questions over and over again from doctors and researchers. And we'd be like, all right, we'll do a session on that. And so we just built up a lot of the educational community there as well around understanding like opportunities in digital health and how to do it well and not get in trouble, and how to connect with the right partners and bring your ideas to life.
That's really cool work, and that's a lot of projects. 200 plus
Yeah.
projects is a lot. You probably got so much experience and just learning so many different things. And as you said, like you leveraged your community and your network, and that probably like brought back even more like positive network energy and vibe into your life, which is awesome. And I'm glad you mentioned like the IRB for these apps because I didn't even think about that, but that is definitely probably a huge part of like development and like pushing out these apps to consumers. So yeah, I'm glad you mentioned that. And I feel like just you saying that makes it clear that there's so many different roles that public health people could play in like these tech organizations. And I just say that to say that, there are opportunities out there for people in public health to take on these unusual or untraditional roles. And I think that just keeping on learning and seeing what you can do with the skill sets, because it's an amazing skill set that you get as a public health professional. And I think it's really like honing on what you want to do with that skill set. So I'm glad to have Katie on here and share some of her very unique positions. And definitely reach out to you if you have any more questions, because I think all of these things are very fascinating, and I look forward to continuing to learn more about this. So yeah. So after this, well, in your current role as the CEO of your own company and digital health consultant at Made Health LLC, I know that you're focused on female founders and around the consumer healthcare space. So, firstly, what is the consumer healthcare space? And then I'm gonna dig into like why you wanted to start this company and the March 1st beginning of it.
Yeah, yeah. So consumer health is really boomed. I would say like most of when people think of traditional of healthcare, they think of going to a doctor's office or like going to a hospital and interacting with somebody in a white coat. And that is how healthcare has worked for 150 years in the United States. and but more and more there's thousands of healthcare apps out there now. And there's the big names that people know about, like Fitbit and Apple and um, you know, Weight Watchers as an app. Noom is like the new weight loss company. There's period tracker apps. There's, I mean, everything under the sun. Mindfulness apps, telehealth apps, all of these things, I would say. And all of those are in basically the consumer health space. Like all of these devices that you can just go into Target or Best Buy or order online and buy that say that they're going to do something to improve your health.
Okay. Well, thank you for that. Definitely. Oh, were you going to say something else?
No, no, that's good.
Okay, awesome. Well, thank you for explaining that, because it is it's obvious in like life, but it's not obvious for us to think about this as being something that people think about and have to actually have a rule around. And it's very interesting in itself. Okay, so you started your business,
Yeah.
Made Health LLC, on March 1st of 2020. Prior to this, what was the thought process for you saying, okay, yes, I want to start my own business?
Yeah, so I actually started the Instagram account probably 18 months before I started the business. And it just came to me one night, this idea of well made health being that like health apps should be what I considered to be well made, which was like beautifully crafted and highly functional. And that I felt like oftentimes in healthcare and in public health, the technology solutions that were put out there were not beautiful and compelling and on par with the consumer space and what people expect when they're using ESPN or Pinterest or Twitter, like whatever apps they actually like to use. And yet we were trying to tackle really important problems. And so I wanted to just start conversations around the importance of good design in healthcare in order to actually move the needle on any of the things that we care about in healthcare and public health. And so that was the impetus for the blog. And I would just write about things I thought were interesting. I'd highlight different folks that were working in that area, talk about some of the things that I learned about, because I also wanted to just educate people in the public health space more on like what opportunities looked like to be outside of traditional public health jobs. And I'd be like, what is user experience? What does it take to build an app? Like, how expensive is it? What type of team do you need to build? And just starting to get conversation and community around that. And then I started hearing about Femtech. So I mentioned early on, like when I did my master's, my focus was on maternal and child health, but then I pretty much pushed that aside in order to jump into this digital health side of things. And then when I was at the hospital, I worked across all of the clinical areas. But over the last couple of years, there's been like this emerging area called Femtech, which is digital health tools for women. And I started to get super excited about it because I was like, I can bring back my maternal child health love and my technology love. And so I just started to dig into it. And I did a lecture at Duke on like, what is this new emerging space of digital health? And I got just really excited about it. And so I started this Femtech Friday series on Instagram where I would feature different consumer health companies addressing women's health needs. And that started to get some traction because I just thought there's so many cool tools out there that millennials may or may not know about. And I'd like to just help them get connected to things that can be useful for them. And so when I decided that I wanted to like jump back in from, instead of being in the academic medical center side, to back to like the consumer side, digital product side of things, like Made Health just seemed like I should keep the name because it still resonated with me.
Okay, beautiful story, beautiful story, and yeah, I'm glad that you took this leap, and I do believe like exactly what you said. A lot of these, like even when I'm thinking about when I got my when I was trying to get a COVID-19 appointment online, the interface that was there was horrendous, and and I'm just thinking about like we have all this innovation and everything that we do in all parts of our lives, but when it comes to these things that are so important to for us, like living healthy lives and things, and it just isn't there as yet. So I appreciate you making this organization and really pushing that forward, because it is important, and I hope that we are able to get like cool interfaces and user experiences on these health apps and different things like that. Like another thing that comes to mind is when I was right before my MPH, I worked at the VA, well, I volunteered at the VA hospital, and they had a service, My Healthy Vet or My Healthy eVet or something like that. Interface was horrible, was horrendous. And I'm like, there's got to be a better way to put this out to all these vets that have saved the country. But I don't know. I don't know.
Yeah, I mean, and electronic medical records are like notoriously poorly designed, and yet doctors spend so much of their lives in there. One of my projects at Duke was to think about like redesigning what the digital health like patient experience would be like. Like, could we set up a place in the hospital where if the doctor says to a patient, you need to get more exercise, they could come in and we'd have like multiple fitness trackers and say, what do you like? Like, what does your budget look like for this? Will your insurance pay for any of it? And then we could actually sit them down and get them set up with it and get them excited about it. I think some of that stuff is still a little bit of a ways away, but I'm also particularly interested, I think, in some of that like crossover into the consumer health, into the traditional healthcare delivery space, like how we can better use those tools to care for people with managing chronic diseases as well.
Okay. And tell me more about starting your business in March 1st. Like well, you said earlier that you got the flexibility with your kids being out of like childcare for 18 months or however long that was. But I'm guessing that there were a lot of not so great things that came about launching that business. What was that journey like for you in those early days?
Shake it off. Good into the dark times. Yeah, what I didn't mention was I was also just coming off of my maternity leave. So I had a 3-month-old. I was still not sleeping through the night. I was still getting up multiple times during the night. But fortunately, my first client I had lined up for the day that I started. And it was someone that I had worked with on a collaborative project between Duke and another hospital. And he had spun out his own company. And so he wanted some help with marketing and like establishing their brand in the space. And he had young kids also, and was, navigating the same issues that I was, and just said like, hey, I'll take you for as many hours as you can give me, and we'll just try to make it work. And so that was a lot of like, I put the kids down for naps, and I'd work for 2 or 3 hours in the afternoon. I'd get up before they got up and try to do things for a couple hours. And sometimes it would be after bed, but it was just fitting it in to however I could. And honestly, like, that's still a little bit about how it works today. In January, hopefully that will be different. My 2-year-old will finally be able to go into daycare with my older daughter, but we've still had like random, like this week, we had a shutdown because there was a COVID case in her class. And so she's home with me again for the week. So I think that that's like a lot of other parents out there. We're just doing our best to navigate like every day what we can do and get as much in as we can and be flexible. But for me, it was also like an outlet for my sanity. Like so much of us, were locked down and away from the people that we loved. And it gave me a way to continue to connect with the rest of the world and do things that I thought were interesting and work with other adults instead of just having conversations with 2 tiny humans during the day. My husband, being a doctor, like was going out and being in the hospital. So it was just me alone a lot. So it gave me an outlet there as well. And I've been fortunate that ever since I started, I've kind of had consistent client work too. And so a lot of it's just come to me through my network and people that have heard about me, or they get referred to me somehow, which is really nice.
Yeah, no one's complaining with referrals. That's an awesome way to get business, right?
Like, okay, cool. You already seem like you trust me, so that's good. You have to build that whole foundation.
Yeah, that's awesome. And shout out to you as a parent and all the other parents out there during this pandemic. It has been tough and it continues to be tough. And I hope that we are able to get to some sort of better, I don't know, societal systems in place for parents. I don't know. I know childcare is like a burden. All my coworkers tell me that I have to apply now. And I don't have like a wife or anything like that, because apparently all the childcare where I am in Winston-Salem is like booked up for like years or something like that. It's pretty wild. Pretty wild.
Yeah. So I'm like, my daughter's 2, and we've had to be able to piece it together, at least with like grandparents helping out here and there, and working naps, nights, weekends, that kind of thing, whenever I can get it done. But hopefully in January things will be normalized and I'll get to scale things up a lot more.
Yeah, absolutely. And I look forward to that. So on the side of like you getting referrals, what kind of services do you offer?
So I generally work with people that are, I would say, early to mid stage. So like between 5 and 30-ish people within the company. And I do like product marketing and communications. And so that can look like they have an early stage version of an app and they're just saying, okay, people aren't using it or they're not happy with it. It doesn't feel right. How do we make it better? And then I'll just come in and gently tear it apart and then give them suggestions for how it can be changed, and then work with either people that I know, they're designers and developers, to fix things, or they sometimes have their own contractors that I work with. I've done some communications work as well. So for example, I'll write like ghostwrite op-eds, or a lot of apps have in-app content where they have health articles about different health and wellness type things. I'll research those and write those, and those will go into different apps or on websites. I said op-ed pieces, LinkedIn articles, and then I also do market research for folks as well. So like they come to me with an idea, and this is some of the stuff that I leverage from my Duke days, which is I have an idea for a company or I'm an early stage company, how do I set myself apart in the market? And I'll look at like, okay, let's look at every weight loss app that's on the market right now. And what do they do well? What do they not do well? And then what does the literature tell us? And then I'll like dive into PubMed and say, okay, what are these studies telling us that actually work for weight loss and engagement, sustained engagement over time? And like, how do we improve your product to match those best practices? And so that's a little bit of as well. Had another project where I did some research on like, they were a lactation telehealth company. So another that maternal child health bit. And they were trying to be available to Medicaid moms. And so I did a month-long research into what like Medicaid coverage looked like across all 50 states to figure out what they covered as far as lactation support went, and then gave them like their top 5 states that they should go at from a business perspective that would be open and supportive of like telelactation versus in person, or lactation support at all. So that was like, whew, brush those public health skills off. Like, real deep dive there back into health policy work. But it was really fun, and I'm super proud of that work that I did. And from there, I also helped them write some white papers and pitch decks that they could use with legislators and policymakers around like the benefits of both telehealth and lactation support for new moms, especially lower income mothers. So it's like all over the map. I read this article the other day about creating a career portfolio instead of a career path. And I really liked that because I felt like that's almost what I've done. Like I've just followed things that I thought were interesting, and they have built up these various skill sets. And now, because I run my own company, I can take on a lot of different types of projects, and I don't have to be like pigeonholed into one job where it's like, this is what I do day in and day out. Like I can do a product strategy piece with somebody, and then I can, the next day, like jump in and I can write an op-ed on health equity, or like a CEO of a healthcare company that wants to say that they're in the game and what they're doing for that. So that's kind of cool.
Yeah, and I love the cross-sectionality of your skill sets. And I think it's just very unique strengths that you're using in your skill sets and in the work that you're doing, which I think is amazing. And I think a lot of people should try to do that, like try to corner the market, like health tech, public health. I know all these things. Let me be this person to really bridge that gap. And I think that it is amazing work, and I love the things that you're talking about. And I hope that a lot of people who listen to this reach out to you and ask more about it, because I think there's a lot of space for people to get into this type of work. And on that, and considering that you do work primarily with like female founders, what advice would you give to people in public health that are interested, specifically women interested in like femtech? What advice would you give them?
I think like there's so many companies out there and so many jobs. I have multiple, I just like to keep tabs on like who's growing in the industry, and I have multiple LinkedIn alerts set up for companies, see what types of jobs are out there. And there's so much opportunity. There's so much more than when I first got into it, which I think is awesome. I Everyone looked at me side-eyed when I took a job at a tech company after my MPH. Like they were like, "What are you doing?" And yet I think more and more, like for example, that crossover between clinical research and consumer health, like there are people, like there's a chief science officer at Headspace that basically runs trials where they can see if their apps work or not, and then they have a whole research team under them. And so like a lot of those folks are MPHs, and that's a really awesome way to be like, A, get a better paycheck, and like B, be in a kind of cool brand type of environment while also flexing your public health skills. There's those partnerships types of roles that I mentioned where you're, crossing the divide between like people and technology, or healthcare and technology. When I was at Duke, my partner, so I was associate director with another woman, And I was mostly on like the clinical and entrepreneurial side of things, and she was mostly on the research side of things. And so like she came up as a clinical research coordinator and sort of went on that track and climbed the ladder at Duke, and sort of like me, just started to get interested in digital health, volunteered to help people figure out how to navigate that space, and then ended up, in a pretty high level position and getting to work with tons of researchers and stuff. And so I think one of the great things about digital health and health technology in general is that it is so new and there's so many ways to get into it. And I gave a talk once and I was like, literally nobody majors in health technology. You may see some MPH programs that have that stuff now, but you don't do that when you're coming out of high school. And so everyone comes at it sideways in some way. And I think it's just, finding things where you don't have to, when you apply for jobs, you don't have to meet 100% of what they're looking for. Like meet 60% and then tell them you're willing to learn the rest. And, if it's a tech company you're interested in, like bring in your hard-hitting healthcare, public health skills and learn the technology piece, learn the business piece, and you'll do great.
Love that advice. Thank you so much. Before I move you on to the Furious Five, I would like to ask, where would you like to see yourself in the future?
It's tough.
It's a big question.
I think one of the things that I've been like noodling about is, as some of these companies that I've admired have grown from like itty bitty startups to now huge companies, like Maven is one of them. And then Tia, they're just huge names now in telehealth and digital health experience, especially in women's health. And I'm like, would I leave my consulting to work for one of those someday? But I don't know. I don't know where it'll take me, because right now the thing I love about the consulting is the flexibility. Like, I love to travel. One of my goals is to like take my kids to as many countries as I can before they go to college. And working for yourself, you can plan out the time to be able to do that. So next couple of years, I'll probably keep doing this, but who knows? Who knows about that? I mean, clearly looking back, I could have never predicted any of the things that I ended up doing. So who's to say?
And I think that's the beautiful part about it, right? It's like we never know where we're going to be, but we still trot on, and we are still learning as wherever we are in our stages in life right now. We're still learning, and I feel like a lot of us still don't know what that ultimate goal is, but we're definitely hitting the goals that we have set along that path, and have gotten and done amazing things. And I think it's important to reflect and understand that we have done great things to get where we are right now, and we will continue to do great things to get where we will be in the future. So I look forward to seeing wherever that is for you. And I just love that I've been talking to a lot of people who've been continuing talking about like freedom of time and just having that kind of relaxation, which I think is hugely important and not really spoken about enough in life. So thank you for sharing that.
I think that's one of the other things that I wasn't planning on talking about when I started the Instagram account, but I've started to become more of an advocate of like flexible working and what it means to be a working parent as well. And so I just try to provide like totally honest thoughts about my experience and opening up those conversations for people. And I have found that vulnerability really invites good conversation with other folks. And so that's, there's some silver linings to the pandemic. One of them is definitely like the remote work piece, because it is more like, I haven't had a single client in North Carolina. Everybody that I've worked with has been in other states and cities. And that's amazing. Like it opens up so many new opportunities. But then I think it also, because of that, like opens up those discussions around what does work-life balance look like and how do you make it work for yourself?
Yeah, and I think we're all trying to still figure that one out as this pandemic continues to brew. So, okay, moving on to the last section of the show, the Furious Five, the 5-question I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
Number one, work before you go get your MPH, because I think that number two, it's a huge financial investment. And so you want to make sure that that's what you want to get your graduate degree in. And then there's also like dual degrees, like MD MPH or MD MBA or MD JD. And so I think working for a couple years helped me get a lot of clarity on what I wanted to do. But then it also, I provided more value in my classes. And I think that other people that could speak about real life experience provided a lot to the experience for everybody by coming at it with that. Do as much as you can, like work as hard as you can, connect with your professors, and just also know you'll get through it. Like UNC, like a lot of programs are pass fail. They had like high pass, pass, and fail. And we had a saying that there's like more P's than H's in happiness. So like, just if there's a class, like I took biostatistics my first semester, I knew I was not going to be a biostatistician. I had not taken math since my freshman year of college. And I was like, you know what? A P is good enough. Like, I don't have to be the best student in this class. I will focus those energies on the classes that I really love and what I think I want to do within my life. And I think that that's another thing too. Like, take your core classes, they will be beneficial to you, but you have the flexibility of building your coursework around your own strengths, and don't take things that you feel like you just have to take things that you love, that you want to take, because it's an amazing opportunity to spend time on your education. I love learning. And so being a student is the biggest privilege.
Awesome advice. Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
There is no trajectory. I think just like find organizations where you feel like you can add something different and convince them to let you come on and learn as much as you can. And then I don't think I would have been confident to start consulting if I hadn't been working. I think I was working for about 12 or 13 years before I started consulting. So that gave me a lot of time to build up my network, build up my skill set, and then feel like I could actually provide value coming in as like a party of one to an organization. But I wouldn't suggest, I know you've had other conversations like on your Instagram about people like, what about consulting or starting my own public health consulting? And I think other people have also said it's really hard to do that right out of your MPH. You really need to get experience first before you do that. And I would second that wholeheartedly.
Yeah, and I think that also speaks like the imposter syndrome of coming out to your MPH and not knowing if you're doing whatever you're doing correctly, kind of thing. So yeah, absolutely.
You don't know what you don't know. Like, you think you know a lot of stuff, but then you just learn a lot being on the ground.
Absolutely. Number three, what's something you're working on improving in your life right now?
So I mentioned that I like to read, but sometimes by the end of the day, I'm more like burnt out and I'm like, oh, I'll just put TV on or scroll on my phone for a little while. And I'm trying to read a book a month, basically. And so I've been doing that over the last year. And so a couple nights a week, I'll just say like, no TV, no phone, put the kids to bed and open a book. And then that's what I challenge myself to do, is read more, because I think it relaxes me in a different way than watching TV does. It takes me away from screen time. And I still read like real books. Instead of having an e-reader, I go to the library and check books out. And I think that makes me more of the person that I want to be. So.
Okay. Love that. I think there's like a lot of meditative properties in reading. So I second that. Read some more books, everyone. Number four, professionally, do you recommend anything?
I think just stay open and meet as many people as you can meet, and be kind to everybody. Like, you never know when you're going to cross paths with people again. I had a project with Duke when I was at the previous company where I was working, it was a difficult project. There was a lot of scope changes. There was a lot of frustration, I felt like, on both sides. It was one of those things where like the tech people and the health people were having a really hard time communicating with each other. But I just always tried to be the bigger person and make sure that everyone was happy and just be kind. And I ended up in a meeting with the guy that ran that project a couple years later, and he remembered me fondly, which I was like sweating when I saw him. I was like, that was a rough one. And I don't think that would have happened otherwise. And my dad always said, like, nice people remember nice people. And I think that that is also true, that if you continue to be helpful and useful and nice, that, you know, doors will continue to open for you.
Absolutely, absolutely. People remember how you make them feel.
Absolutely.
And number 5, last but not least, where can people connect with you?
So I'm on Instagram at Made Health, Twitter at Made Health, email katie@wellmadehealth.com. You can find me on LinkedIn, Katie D. McMillan, Google Katie D. McMillan MPH, come up across a couple things. And my website's wellmadehealth.com.
Okay. Awesome.
www.wellmadehealth.com.
Awesome. And I'll be sure to link those in the show notes, as well as some of them will be linked in the description of this video as well. But thank you so much, Katie, for coming on and sharing your wealth of knowledge. I really appreciate you sharing your journey and helping us learn a little bit more about tech today. So thank you.
Thank you, Omari. I think it's amazing work that you're doing. I love it. I've listened to a couple episodes and obviously follow you, see all your stuff on Instagram all the time. And it's just such a needed conversation. And I think, like, when I was considering doing my public health degree, I had so many questions. I didn't know like what I was going to get out of it. And it's just amazing that you're curating all of these stories and, you know, building community around folks that are interested in public health and like showing all the different ways that you can use the degree and be in the field, and super valuable. So props to you.
Thank you. I appreciate that a lot. And thank you for adding your story to all the other stories. And I know everyone's going to definitely enjoy it and find it very valuable. So I appreciate that. And then housekeeping items. Thank you everyone for tuning in today. Be sure to subscribe if you haven't subscribed. That's both on podcast platforms and on YouTube. Make sure to leave a review, to leave a like, to share it with a friend. And if you'd like to support, you can go to buymeacoffee.com/the PH Millennial, buymeacoffee.com/the PH Millennial. There's also a new, actually I should make a pretty link for it. It's going to be the phmillennial.com/support, and there's a link to support me on there as well. So I will see you all next week. Peace out, everyone.